the practices that have used this drug in order to identify potentially variables or factors that might be associated with optimal outcomes, whatever the intended use is for DMT. And so I think having a full appreciation, awareness, and a respect for these cultures is paramount, and we need to sort of anchor any further sort of research or understanding in that awareness. I will say I am of the camp that just because if something has been done traditionally doesn't necessarily automatically mean that it is of net positive or net good. I think we still need to look at things critically and with an open mind, but also be critical. And I'm also aware of the limitations of how we can integrate the therapeutic use of DMT in a way that is accessible to individuals to give the most benefit and reach individuals in need. So not everyone can potentially afford an ayahuasca retreat or afford a clinical setting whereby you have to have the drug administered and then multiple psychotherapeutic sessions after. I do understand that that's the model that has shown the most efficacy. And I think this kind of leads to the question, like, where does DMT sit in society today? And I don't know the answer to that, because I would say I think a lot of leaders in this space have received a lot of benefit from DMT and psychedelics in naturalistic settings. And I would be hard pressed to then, and they should be hard pressed as well, to turn around and say, well, I used the particular substance or DMT or psychedelic in this setting, but everyone else should use it in another way, in a highly potentially cost prohibitive way.